Okay, so we are now recording, and again, good morning and welcome everybody. It's really nice to see you here on this beautiful sunny Saturday morning in Ventura and Oxnard or wherever you might happen to be. Nearby it is just a gorgeous day. And what we're going to do today is just update you. There's been some important benefits and some important changes that have happened relative to health and safety in the workplace related to COVID-19 and other things. So, excuse me. So I promise that we will definitely get done and all of you back to whatever you're doing by 11 o'clock at the very latest. So um, in fact, we might even finish just a little bit early. This group is a little bit smaller than our last one. And so what I'd like to do, though, to begin with is do some quick introductions because not everybody knows everyone. And so what I'd like to do just briefly is if you could just say your name and how long you've been with CSDS and who you are supporting right now. And so while you're just taking a moment to prepare your brief comment, I'll start. So obviously, I'm Richard Sokol, and I'm the owner and director of CSDS. And we have been providing excellent services in Ventura County since 2008. So we are in our 12th, 13th year of operation. And we are excellent and have a wonderful reputation because of all of you, because of the fine, excellent work that you do every day. So much thanks and appreciation. But my role is, in terms of who I support, is I support all of you. So I see that my role is to make sure that you have everything you need to do your job and to do it well. So I support all of you. I support all of our clients and families. Okay, so that's my brief introduction. What I'm going to do is just point to the people that now we all have these little boxes on our screens, and they're in different order just depending on where you are. But for my order, I'll just kind of point it out sort of from left to right, top to bottom. So the very first person I have is Josefina. So Josefina.
Hi. Good morning. My name is Josefina. I've been with CSDS 5 years, and I've known Richard for way longer than that. But it's been a pleasure knowing Richard and now working under your direction. And of course, Sally, wonderful Sally. She's awesome. She is very supportive and always. So I work for Joe, and that's the only participant that I support.
Right. Yeah, you've supported several others in the past, but yes, thank you, Josefina. Appreciate that. Okay, so next I have is Felipe.
Good morning, everybody. My name is Felipe. I've been with CSDS, I think it was 6 years this past October. I think I've lost track already. Yeah, I think it was 6 years this past October, and I support Alex, Gary, and Chris. And looks like I will be supporting Thomas, a different Thomas, and Matthew.
Yeah. Yeah, that's right. We have a couple new people coming on board to receive support. So that's great. Thank you, Felipe. Next I have is Crystal.
Guys, well, I'm Crystal. I've been with the company for about 5 months now, and I'm obviously your HR person and here for whatever you guys need at all times.
Great, thanks, Crystal. All right, and then I have Priscilla.
Hello, my name's Priscilla. I work with Rachel and Tom on the overnight shifts, and I've also worked with Joe a couple nights in the overnight shift.
All right, great, Priscilla. And we understand too that you're going back to school, and so you're going to be leaving us soon.
Oh,
so
yes.
We're so sorry to see you go, but we definitely have appreciated everything that you've done to support our clients. You've helped us out of some tight spots when the pandemic was really raging and we had some people out sick and just different things. So I really want to thank you for all of that, and just know that we wish you well with your education and your career, and just know that the door is always open too if things change and you're looking for some employment opportunities. Please, come and find us again.
Yes, thank you so much. I'm gonna miss everybody.
Yeah, we'll miss you. We'll definitely miss you. All right, so next is Daisy.
Hi, I'm Daisy. I work with Rachel, and now I'm going on my 4th year with CSDS.
All right.
All right, thank you, Daisy. And then next is Sally. And before she says hello, I did want to just congratulate her on completing 10 years
That's a long
of
Hey.
service here at CSDS. So she just had her 10-year
Bravo.
anniversary at
10
the end of
years.
last week. So Sally, I really greatly appreciate you and all the wonderful things that you do for our families, for our clients, for our staff. You're sort of the hands and feet, the eyes and ears of CSDS. So really want to express my deep appreciation for you and for
Thank you.
your participation here with us. So, okay, anyway,
Thank you.
next,
Thank
go
you.
ahead.
Feelings mutual. Hey guys. I haven't seen a lot of you in a long time. I connect with you guys by text a lot. Me and Josefina are texting a lot. Felipe. I think I just checked in with Daisy. So I appreciate you guys all. Like Richard said, I've been here about 10 years. I'm your support supervisor. I've actually met all of you probably in person. The last meeting we did on Thursday, there was like a handful of people I've only met by Zoom. As we're doing the new hire trainings, it's all like this. I have my son here with me today, Mr. Wiggly. So he just turned 8 months. He's teething, so I may have to step away from time to time. But so far, Mr. Potato Head is keeping him busy.
Nice. Thank you, Sally. Okay, and then next is Julia.
Good morning. I'm Julia.
Hello,
and
hello.
I work with Tom, and it's gonna be close to a year now coming up.
Yeah, wonderful. So happy anniversary. You came at the most interesting, difficult
Yeah.
year ever. So if you can get through this, you can get through anything. All right. Well, great. Thanks, Julia. And then Ricky, you're next.
Good morning, everyone. My name is Ricky. Apparently 8 years. I just found that out like a week or two ago. Time flies by. I work with Dan, Mitch, and Travis. I used to work with Joe and Tom as well, along with 2 others, Jed and Jonas, and gosh, I can't remember anymore, but I had to slow down because there was a change in my main job. So, but I'm still here and yeah, loving it. And so congratulations to Sally. Likewise, I want to thank her. Obviously, management and supervisors are important where you work. And, Richard and everybody gives me a lot of credit for the success with the clients that I work with, but truly, I do get a lot of guidance from Sally behind the scenes. So I just want to make sure Sally gets that credit, and I really appreciate it. And
Thank you, Ricky.
yeah, and congratulations, your son is beautiful. And my gosh, I thought he would be still in a little crib, not able to move around.
This guy.
I was really concerned because, he was born during the COVID time. So I was like, I wonder what's happening. And
Yep. Healthy.
oh
Kat
my
did a
God.
great job keeping safe.
So double congratulations.
Thank you.
He's gorgeous.
Oh, Richard, you're on mute.
I don't think we can. Yeah, I think we can unmute Richard.
Oh, so sorry, I had my microphone mute. My dogs are running around, so if you hear something that sounds sort of like ice on a tin roof, it's just my dogs running around. So Ricky, you had your anniversary month. Is it this month, April, or is it May?
Crystal, I'm sorry. It's already.
It's April, the 1st of April. So it was April 1st.
Okay. All right, it is April. So yeah, so happy anniversary. I have to say, I also want to appreciate Ricky because Ricky has a very, how shall I say it? He has a skill set that enables him to work with some of the most resistant and challenging individuals that we have. And so Ricky has just, he hangs in there with people, and just recently asked him to help with someone that I've been supporting throughout the pandemic remotely. And he's up there in the probably top 3 or 4 in terms of just hard people to support. He's really resistant. He's very negative. He's very critical. He's very hostile, verbally hostile. And I told Ricky about him, and he's like, "Oh, that sounds like a great challenge." So I'm up for it. So I don't know. So Ricky, you're like a glutton for punishment or something. I don't know, but really appreciate you. All right. So next we have is Dakota.
Hi, I'm Dakota. I'm new. I've been here for 5 months, and I work with Rachel and Joe.
Great. Yeah. Thank you, Dakota. And I know you've also came in at a time too when we needed a lot of extra help. And so I know you've been working extra hours, extra shifts, overtime, filling in where you can. So really greatly appreciate that contribution to Rachel. And are you working with Joe also?
Yeah.
Yeah, Joe and Rachel right now. Okay, awesome. So that's everybody. Quick intro. And so what I'm going to do today, a couple things. First is I want to go over just some new health information and benefit information with regards to some changes, which I think you'll appreciate. Then we're going to talk about our new health and safety policy with regards to infectious diseases, and in particular COVID-19 and maybe other things as they roll around. So we've made some changes there, and so I'm going to talk that through with you. To help me do that, from time to time, I'll use my share screen function. So I'll kind of pop in and out, and hopefully with your device, you'll be able to see okay. And yeah, we'll just kind of go through it. Like I said, it won't take too long. And then we'll come back, like I said, sort of pop in and out of the shared screen function. And then I'd like just to share some personal experiences with vaccinations. So share my experience, and some of our other people here today have also gotten their vaccinations for COVID. And so I'd like to give you an opportunity to share what that experience is like for you, because I think if they're feeling any kind of hesitancy about getting vaccinated or skepticism, it really helps to hear people's experiences and not just, maybe some crazy sort of like far out opinion online on social media or something like that, but really sort of bring it back to reality and put our feet back on the ground. So, excuse me. So that's what I hope to do moving forward. So let me share my screen right now and go over some important info with you. Okay. So I want to start by giving you some good news. So the good news is that in March of this year, so just last month, a new supplemental paid sick leave benefit was approved by the legislature and signed into law by the governor. And so it's called Senate Bill 95. And so Senate Bill 95 gives every employee in the state of California extra sick time benefit hours that are paid at their regular rate of pay for COVID and COVID-related care and situations. So the time period is actually retroactive. So it goes back to January 1st of this year, and this will be in place through the September 30th of 2021. So what it means is that If you are unable to work or telework, what we call remote contact, if you're unable to do that for these reasons, so if you need to care for yourself because of a quarantine or isolation period due to COVID-19, or if you've been advised by your health provider to quarantine, or if you're experiencing symptoms of COVID-19 and you're in the process of seeking a medical diagnosis for that, that time away from work can be claimed as sick time. Also, if you're caring for a family member, so it's not just you, but if you're caring for a family member who is in quarantine or isolation related to COVID-19, so caring for your child, that also counts. And again, this is COVID-19 related. You can also access those sick time hours. In addition to that, so getting your vaccination, so if it's vaccine related, time that you take to get your appointment and vaccination, or if you're experiencing side effects or symptoms after your vaccination, you're not feeling well, you're feeling tired, what have you, and you need to take time away from work, you can also access your supplemental paid sick leave. Okay, so hopefully that's clear to everybody. What we decided to do, I can't remember exactly, was it last month? It was sometime in March, I believe. But we decided as a leadership team, so Sally, Crystal, and I talked about the situation, and we have been encouraging all of you as support people to get vaccinated as soon as possible. But we wanted to sweeten the pot a little bit and give you an additional incentive. And so we took the decision to offer a $150 bonus for vaccination. So if you just got your second dose, or if you just completed that, send in the documentation that verifies your vaccination. So whether that's your little vaccination card or maybe a letter or a note from your doctor, send that to Crystal in HR, and then she will process your $150 bonus on the next payroll. So we had a number of staff were able to receive that bonus on our last payroll. We'll have some more on this payroll. And if you're in there, again, just get your documentation to Crystal as soon as possible. And then on the very next payroll, we'll process your $150 bonus. So we have so a nice little incentive for you. Okay. And again, we just thought it was that important. We think that, again, following the science, following all of the guidance and advice from our public health authorities, so the CDC, the FDA, local and state health authorities, they are recommending that everybody receive their vaccination. However, there are a couple of exceptions. So there's a religious exception, and there's also a health exception. So if you have some type of health condition, again, you don't need to share that with us, but you just would let us know that that is your situation. We keep all of that information confidential, and then we can provide with what is called reasonable accommodation for that exception to be put into place. What we have decided to do, though, in the future, moving forward, is that we are asking, that is to say, we are requiring all staff to be vaccinated no later than July 1st. So that gives all the rest of April, all of May, and June. But by July 1st, we are expecting for all of our staff to be vaccinated or to communicate with us and have a conversation about a possible exception. So it needs to be one or the other of those things. And so I guess what I would say then is don't wait too long. Sometimes it's like, yeah, mañana, I'll do it tomorrow. I'll take care of it later. Do it as soon as possible. It was the case that in the month of March is very, very hard to get an appointment. Really, really hard to get an appointment. That is changing. There are a lot more options now available. So it used to be there was one vaccination site in Ventura, one in Oxnard, and one in Thousand Oaks, and that was it. Since then, now we've got pharmacies that are providing vaccinations. So CVS, Walgreens, I heard the Med Shop here locally is offering vaccinations. There might even be another pharmacy out there. There are, in addition to that, there are these pop-up clinics. So no appointment is needed. You just need to get online and find out where they are. There's actually one today. So if you want to drive to Piru, you can actually go without an appointment. But the point is that these pop-up clinics are also coming online. And so I know of at least one of our staff that just went. There was one in Oxnard a couple weeks ago, and she just went and got her vaccination there. Kaiser insurance, so your health provider might also have vaccination. So there's a lot of different ways now to get vaccinated, and so the rate of vaccinations are increasing, or is increasing quite rapidly, which is great. So I wanted to share just some statistics with you. So as of today, over 500,000 vaccinations have been given in Ventura County. So that's more than 500,000. And so that's first dose. And in terms of the overall population, just nationally right now, 1/4, so 1 in 4 Americans is now fully vaccinated. And the vaccinations are starting to increase 3, 4, 5 million doses per day. So there's 200 million shots that have been given. And so that's really great news, because we're going to reach community immunity, or what's called herd immunity, which will really be very effective in controlling the spread of this infection. There are some variants and variations from Brazil, South Africa, UK. Some of these variants are even more contagious than the original COVID-19. And so again, we don't want to let our guard down too quickly. So we should still continue to keep ourselves safe by, following all the just basic guidelines that we have now become very familiar with. So masking, hand washing, and social distancing, and then just, not going into public places unless it's really, necessary. Avoiding large crowds, things like that. So all those things are still in place, and we should keep that going until we get guidance otherwise. But the good news is that lots and lots of people are getting vaccinated. Case rates are way down. If you remember at the beginning of the year, they were like 1,500 cases per day. That was just crazy. So now it's about 50 cases per day. Which is still a lot, but in comparison to where we were 3 months ago, the situation has dramatically improved, and that's really good. So with that, I wanted to just talk on a little bit more personal level about vaccinations, and talk about what it was like, just my personal experience, and also just tell you kind of my rule of thumb. So my rule of thumb is, as somebody in leadership in this agency, is that I will never ask you as a staff person to do something that I wouldn't do. So that's my standard, that's my measure. So if I wouldn't do it, and it doesn't matter what, globally, across the board, if it's something that I wouldn't do, I would never ask you to do it. So I took advantage of the vaccination opportunity as soon as humanly possible. So, when we got the information from the state that we could qualify for the very first tier of the vaccination rollout, because we were categorized as healthcare workers, we aren't. We do something similar but different, right? So we got categorized as healthcare workers, and so I took advantage of that, and I went and I got my first vaccination in January. I got my second dose sometime in February. And I also asked my family to do the same thing. So my wife, Kathy, who is a manager kind of in my absence, and she also supports some individuals in our independent living skills program. She went and got her vaccination, and my son, who also is a support staff just like you, he went and got his vaccination. So me and my whole family, my mother, my mother-in-law, we all got vaccinated as soon as possible. And so I just wanted to share my experience, which was that for me, it was very, very easy. Because I acted quickly, I was able to get an appointment right away. And it was very fast. It took me less than 30 minutes each time. I got the Pfizer vaccine, and I got it at the Ventura vaccination site. Everybody there was super friendly. It was spacious. It was open, you know, it was in like a big tent in a big building. Parking was a snap. I just parked. I just walked right in. I showed them my ID. I showed them my letter, and they got me in line. I got in. I was, from start to finish, was less than 30 minutes. And 15 minutes was just in the waiting period, in the waiting zone. So after they give you your dose, they have you go and they have you sit down to make sure that you don't have any severe reactions, because if you do, they want to just make sure you're okay. But in my case, the first time I felt a little lightheaded, but it was no big deal. And after a few minutes, I felt fine, and I was in and out in 30 minutes. I did have a sore arm for a couple days. It definitely, you know, felt like somebody punched me in the shoulder pretty good, and I felt tired. But after 2 days, I was good to go. Now on my second dose, same thing. I had a sore arm and felt tired for a day or two, and then that went away. But I did have a little bit of kind of pain, and it felt like warm around the vaccination site. So it's kind of like hot, and that lasted for a couple days, and then I was fine. So that was my experience. But what I want to say is that what I've been hearing and what I understand for myself is that these vaccines are safe, they're highly effective, and they're free. They're also very fast. So once you get your appointment and get that scheduled in and out, it's really, really fast. So that was my experience. Is there anybody else that might like to share how it was for them? Love to hear your story.
I could share.
Sure.
Oh,
Okay,
for it.
so Josefina and then Sally.
I got mine in March, the first dose, and then in April I got my second dose. The first dose, the pain, you know, the process was very, very fast. Like Richard said, you just wait, get in, you check in, and you get your vaccine, and then wait the waiting period just to make sure you're okay. You register so you can get updates and on the smartphone, and I thought that was really awesome, because they with all these processes, they're going to collect a humongous amount of data so they can see about the reactions of the population, because they texted me every day at 4:30, every single day, to check to see how I was feeling. And I thought that was really good. And one day I really got a really bad headache, but I don't think it was related to the vaccine, because I get headaches anyway. But that was really, really easy, the first dose. The second dose, that was a different story. I felt really, really bad. I was, for a couple of days, I got fever, all my back really ache, like if I would have the flu really bad. But then after like 3 days of fever and cough, and I think very COVID symptoms with that vaccine. But then I'm fine, you know. Yeah, the arm hurt, but I'm glad I got the vaccine. I think all of us should get it.
Great, thanks for sharing, Josefina. Sally, you want to just give us your
Okay,
experience?
I've only had my first dose. I've got the Moderna. I had a pretty sore arm, I'd say, a little bit of a stomach ache. The most unusual thing is I was like really, really tired. I like maybe a couple hours later, I literally was just like, I can't stay awake. I can't stay awake. just really tired. I haven't had a second dose yet. My wife has, and she got sick, like flu-like symptoms, fever and stuff. So I expect I will too. I'm hoping I don't, but fooling myself because everybody that I hear that got the Moderna definitely feels it. But I feel safer. Having the baby in the home, we decided it was going to be the safest. We weren't sure at first. My wife is breastfeeding. We've been in quarantine. We don't really go anywhere. But as soon as we got our first doses, we started feeling safer. Even to be able to go into like the grocery store. We did a lot of like Instacart, DoorDash, stuff like that to bring us stuff. And now it's like, can we go? I don't know. So we're still really cautious. I'm not fully vaccinated yet, but I mean, so far it hasn't been bad, and I started feeling safer right away.
Great. Awesome. Anybody else like to share their vaccination story?
I can go.
Okay, Crystal.
So I was like full of anxiety just because also didn't want to get sick, and I have like a fear of shots and all that, but it wasn't too bad at all. I went and it was all just a quick process. I got the Pfizer. The first dose, I didn't really feel anything at all besides a sore arm. The second dose, I just got really sleepy. My back hurt a little bit, but I didn't get sick or anything like that. So it really was just for like a day that I felt sleepy, and then the next day I was fine. So it was kind of, an easy thing for me. I know other people do get like a little more sick, but I was just too worried about it, but it wasn't as bad as I thought.
Right. Good. Anybody else?
Oh, and then just let me comment about, well, I got the Moderna vaccine. I think the instructions that we got after we got the second shot, the lady said that we still need to wear a mask. We still need to just follow the precautions that we're doing right now.
Yes.
It doesn't mean you get the vaccine and you can remove the mask when you go outside.
Right.
No, we
No.
still need to wear the mask, and we still need to follow the same precautions to protect the rest of the population, because
Yes.
we can get it. We might not have the symptoms, but we can share it. So we still have to wear the mask. And I think that was very important to mention.
Yeah, same. I
Right.
agree. I know that we've talked about the CDC says, if you're vaccinated and you're vaccinated, you don't have to. It's your comfort level. Here in my household, even if we're around someone that's vaccinated fully, we
Yeah.
still ask like, hey, wear a mask. It just makes us feel a lot safer to keep the mask on until the mask order is uplifted and we're told like, hey, this pandemic's here, but you're all safe. You can take your mask off. It really, it's your preference on how cautious you want to be. Some people go, like I was reading on social media, a friend went to see her mom for the first time and they decided they're both vaccinated, so they didn't wear masks, but they don't live in the same household. I think we probably wouldn't do that, but everyone kind of has their preference. So you guys just keep safe and do what's safest for you.
Right. Yeah. And the science is, we're gathering data and we're learning as we go. Right. So, even think back to the beginning of the pandemic, we were told, oh, don't wear a mask unless you're sick,
I
and then
remember.
obviously that we learn, no, that's not right. So masks actually are very effective at preventing spread. So everybody should wear a mask, not just if you think you're sick. So, these things change. We're constantly being updated. And so we're keeping current as that. So, a really important change that happened on Tuesday of this week was the halt of using the Johnson & Johnson, because there were 6 women that developed a very rare kind of form of a blood clot, and they think that it's related to the vaccination. So this is after 8 million doses, 6 people, so it's less than 1 in a million. So just to put that in perspective, that would be like Ventura, Oxnard, Camarillo, Thousand Oaks, Moore Park, Fillmore, Ojai, Santa Paula, Piru, and all the unincorporated areas in Ventura County. And then just for good measure, throw in Carpinteria, Santa Barbara, and Goleta, and 1 person had a severe, maybe perhaps life-threatening reaction. So it's, put it in perspective, it's 1 in a very, very large amount of people. But for me, that actually gave me confidence because I know that our health authorities are taking safety very, very seriously. And so the fact that they found that information out, they paused and said, you know, we want to review it more, actually gives me even more confidence, because what that tells me is that the other two options that we have, both the Pfizer and the Moderna, are safe. So they are still safe and very, very effective, if not from fully preventing the disease from COVID, from preventing hospitalizations and severe illness from the infection. So that is like super, super good news. So I just want to let you know that, to put that in perspective, because again, you might still be feeling a little bit hesitant or maybe even skeptical because it's so new, or whatever your reasons might be. So I understand that. But what I'm putting forward here is that we're following the science and we're following the guidance of our public health authorities, who I think are worthy of our trust. Okay, so so again, like what people are describing, you know, some pain, some redness, swelling in the arm, you know, some fever, chills, tiredness, headache, nausea, some muscle pain. These are typical, they're common, you should expect that. Usually these side effects are mild to moderate, and within a couple of days you get back to normal. So with that in mind, you might think about that too. So when you schedule your appointment, think about your work schedule, because you may not want to go to work that day or maybe the day after. You want to take some time to recover, and you know, you don't want to be, you know, clocking in and not feel well. So that would be good to talk about with Sally. If you're planning ahead, I'm always a big proponent of planning versus, you know, kind of being in a crisis moment and then everybody gets stressed out. So thinking ahead, planning ahead, is a great way to reduce anxiety. And then a second point is just to know too that if you're a younger person, in all likelihood, you will have more side effects. So for whatever reason, maybe the immune system is stronger in younger people, perhaps. I don't know what the scientific reason is, but younger people tend to have more side effects and older people less. And so just as an example, this is anecdotal, but I know one of our staff members who's a little bit older had like no side effects at all. So she told us, I had no side effects. I was fine. I got my vaccination and I was perfect. And I was like, great, lucky you. That's great. My mother-in-law was vaccinated. She's 84. She had like no side effects at all. So it just depends. It depends on different factors. So are there any questions or comments about what we've been talking about here with regards to vaccinations? Okay. All right. Well, hopefully that means I explained it well. If you do have a comment or a question and you're just not comfortable sharing it in this group setting, that's okay. Please reach out to Sally or to Crystal or to me if you'd like to. Again, we want to be, you know, just open and have an open, you know, clear communication with you about whatever it is that you're thinking. Okay. All right. So I wanted to share my screen again too and just show you a couple ways to make appointments. And for those of you that have already done this, I don't know, I guess you can kind of just pause for a moment, but not everyone has. So I just want to share my screen here, show you a couple things. So this is the dashboard. This is Ventura County Recovers. So if on your device, your mobile device, your tablet, your laptop, whatever, if you just type in Ventura County Recovers, it'll bring you to this page. This is just some information. So this is what I mentioned earlier. So there's been 561,155 doses as of yesterday. That's a lot. So that's half of the county right now, just a little over, have gotten their first dose of the vaccine, and 34%, essentially 1 out of every 3 people now in Ventura County are fully vaccinated, which is really cool. All right, so there's different tabs. It says here, vaccine appointment information. So I'm going to click on that. And then this is info about who can receive. So since April 15th, if you're 16 or older, you can get vaccinated now. Talks about what you should bring to your appointment, your ID, your birth certificate, however, you know, whatever ID. Driver's license is probably the most common. Post-vaccine information, we just talked about that. And then registration. So a couple of options here. Register for first dose, register for second dose. So I'm just going to click on register for first dose. We'll see what comes up here. There is now a new portal, which is myturn.ca.gov. You might want to write that down. Also, this information sheet that I showed you, actually, no, I don't think we put that in there. You know, I'm going to add that. So I'll add this portal link here so you'll have that in the information sheet. So I'm just going to click on that. So it'll bring you to this screen. And now this is where you put in your information. My guess is because it's Saturday, I don't know if we're going to find an appointment available, but I'm going to try. So English, find an appointment. They ask you to verify the privacy statement and your age. So I'm just going to kind of go through this, go through the motions. Ventura County. Do you work in a different county? No. There is no access code, I guess, unless you receive one somehow. I'm certifying that I'm 18 years of age or older, and I'm certifying that this information is accurate. I'm going to click on continue. Okay, so then it asks me, I'm just going to put in the Ventura zip code here. So you would put in your zip code. No appointments are available. All right, so there's a little box here that says notify me when appointments become available. So that's kind of a nice little, that's a newer feature. I haven't seen that before. I'm not going to put my name in here, but I could do that and then probably click submit. Looks like there's a couple of other questions down here. Phone number, email. I did do this similar. I'm going to stop sharing the screen now. I did a similar process like this with one of the people that we support. And then I was able to get information for him and get him scheduled for an appointment. But we're just talking about doing it for yourself, but also maybe you want to help out a family member too. So, you know, I think the information is helpful and just kind of go through a practice run on that. So any questions about that? How to register or get an appointment? If you don't have regular access to a device or internet, there's also a phone number that you can call. So I'm going to put that on the screen right now for you. So I recommend that you take this number down. It's not that number. Let's see, can I erase it? Well, I'm going to go ahead and just put the number. I'm not sure how to erase that exactly. Okay, so the number to call is 833-422-4255. So 1-833-422-4255. So you can call that number and you can schedule your vaccination appointment. And the hours are Monday through Friday from 8 to 8. And then Saturday and Sunday from 8 to 5. Okay. So again, that number is 1-833-422-4255. Okay, that's how you clear it. All right. Let's see here. How are we doing on time? Well, we got about 10 minutes left. So let me just go back and share a couple things on this document here with regards to our policy information that I mentioned. So what we did was, in terms of developing our policy, we went ahead and reviewed all of the applicable information. So from the Department of Fair Employment and Housing. So I put that link on there. So this is about COVID-19 and rights, responsibilities, and benefits with regards to your employment with CSDS. Also information from the EEOC, the Equal Employment Opportunity Commission, Cal OSHA, and the California Department of Industrial Relations, DLSE. So we'll provide that information to you. So if you're still wondering or have questions, you can go ahead and do your own research and verify that we are acting within compliance of all the laws and regulations with regards to this situation, because we, again, we appreciate you. We want to keep you healthy and safe. We want to keep your families healthy and safe, and also the people that we support. So that's really what's behind all of this. It's not because we want to ask you, uncomfortable questions about your health or your health care. That's not really what it's about. But because we are in the situation that we're in, we just have to take some extra steps and measures and ask you to share with us a little bit more. So if you do call in sick now, we're not going to just leave it there. We're going to have to ask you some questions like, what symptoms are you experiencing? Have you been exposed to COVID-19? Do you know anyone that's been exposed to COVID-19? And things like that. So, and we do have the ability to do that within the parameters of the legal guidelines that we're given as an employer. So again, it's not because we enjoy getting into people's personal business. It's just that we want to keep everybody safe. Okay, so hopefully that makes sense to you. So with that, I think we're about ready to wrap it up. So let me just kind of summarize what we talked about. So we began our meeting today to talk about this new Senate Bill 95, the supplemental paid sick leave, and you should be seeing that benefit on your pay stub. So we have an accrual that keeps track of all of your sick time. If you had sick time back in either January, February, March, prior to this date, and it was COVID related, make sure you communicate with us so that you can claim those hours and then have your regular sick time hours restored. So if you took, just your regular sick hours for that, then you can have those hours restored and then tap into your supplemental paid sick leave. Oh, and I just realized I forgot to tell you what the benefit is. So I apologize, but how many hours do I get? That's going to be your question. Like, how many, and how do you calculate that? Well, if you work full time, so let's say 40 hours per week, you're going to get 2 weeks of sick time benefits. So that's 80 hours. Okay.
Great.
So that's if you're full time. So you're saying, well, what if I work part time? So if you're scheduled to work 20 hours per week, just hypothetically, you would get 2 weeks of sick time benefits. So 20 hours a week, that would be 40 hours. Okay. So if you work 10 hours a week, you'd have, 20. If you work 30 hours a week, you'd have 60. So hopefully that makes sense to you. And we calculate that based on what you're scheduled to work regularly. Okay. So that's your benefit. And again, just to reiterate, it's for COVID only. So if you have some other situation, I don't know, you sprain your ankle and you need to be out for a couple of days, you have to use your regular sick time for that. You can't use the COVID sick time. So it's specific, and we have to get documentation to support your claim. Okay. So I'm sorry I missed that earlier, but I'm glad I remembered before we wrap things up. So so we started by talking about the supplemental paid sick leave, and then we talked about vaccinations. We talked about our personal experiences with that, our new policy that we are going to require that vaccination starting July 1st. So don't wait too long if you're still waiting, because between your first and second dose, you need to wait about 3 weeks. It depends. The time in between shots is different for Pfizer and Moderna. It's a little bit less time with Pfizer. I think it's a week longer with Moderna. So
Mhm.
you also need to factor that in. So I really would say do it as soon as possible, please. But if you're going to still wait, don't wait beyond, let's say, the beginning of June, because if you're not fully vaccinated by the time July 1st rolls around, we might have to make some changes to your schedule. And we may not even be able to provide remote work at that time. I don't know. It's changing. So right now we do have permission to provide services remotely, but that will end as this, things get better and we get this infection under control in the community. We're going to not have that option to do remote contact anymore. So that will end. I don't know exactly when, but it is coming to an end. I sort of see the light at the end of that tunnel, if you know what I mean. So don't wait too long. Okay, so I think that's it. Again, my great appreciation to all of you for being here on this beautiful Saturday morning. And we're going to end just a couple of minutes ahead of schedule. So be well and be safe out there. Please talk with us if you still have any concerns, questions. We're here. We work together. We're all on the same team. And we're here to support one another. So we're going to do our best to make sure that is your experience with our agency. Okay, so with that, have a wonderful day, everybody, and we'll see you around.
Have a good day.
Richard.
Okay, bye-bye.
Bye.
Take care, everybody.
Bye, everybody.
Bye.